Our mental and physical well-being are inherently connected. We understand the mind and body act as one. Our aim is to empower vulnerable, local and global communities with the resources necessary to support their overall health. Hello, we are presenting to you on behalf of Enactus McMaster. Out-of-hospital cardiac arrest is one of the leading causes of death and disability globally. Harry, a member of our team, lost his grandfather to cardiac arrest. Although his parents immediately called the ambulance, his family felt hopeless as they could do nothing to help. His grandfather later passed away despite being rushed to the hospital. He remembered the doctors saying, "A brain can only survive for 6 minutes without oxygen. This is only one account. This issue can happen to anyone who walks past you on the street, to our beloved grandparents living at home, to folks living in remote areas that lack timely access to ambulances, and the list goes on." Introducing Project Breathe, a global entrepreneurial project aiming to engineer affordable CPR mannequins while providing free CPR training programs both online and in person. We started off by conducting a needs assessment based on existing research. According to the American Heart and Stroke Foundation, 80% of cardiac arrests are witnessed. Bystander CPR is the most significant determining factor for out-of-hospital cardiac arrest. If a witness takes action, the survival rate for the victim will increase by 3-fold. Unfortunately, we found strikingly low rates of bystander CPR practiced in some countries, primarily due to a lack of educational devices and training. We partnered with Dr. Tapaz, one of 2 pediatric cardiologists in Hamilton. Dr. Tapaz conducts seminars in India where only 2% of the population is trained in CPR. Through his research, he stressed the lack of access to affordable CPR training, endorsing Project Breathe. Our plan for action consists of a 2-pillared approach. Our first pillar is increasing access, and our second, increasing awareness. We aim to increase access by engineering affordable mannequins. Many volunteers in developing nations resort to building makeshift mannequins using bed springs, sponge, and plastic. While this is creative, it is not effective for teaching such an important lesson. Currently, a standard mannequin costs approximately $500 on the market. This poses a significant financial burden to global health organizations, an obstacle that we hope to tackle. We connected with a team of senior engineering students at McMaster University who are creating smart mannequins alongside the guidance of medical professionals to ensure their quality. In the meantime, our partnered MBA students have worked to reduce material costs from $200 to $137, resulting in 31.5% in savings. Our second pillar aims to increase awareness through a virtual CPR training platform and in-person workshops. We have partnered with CPR Global, an international organization who shares a similar mission to create free CPR educational videos in multiple languages. Over the past year, we implemented educational workshops within McMaster and our surrounding community, which taught over 132 people bystander CPR. We held 2 sessions at the Ron Joyce Center in Burlington, teaching international McMaster students. After a session, participating students were better equipped to handle a situation where they could make a life-saving difference. Our last session was held at the Aga Khan Ismaili Mosque, teaching immigrants bystander CPR. These individuals were from Dubai, India, Pakistan, Kenya, Syria, Tanzania, and Uganda. This was a crucial demographic to empower, as certain cultural norms can often make it taboo for physical interaction between opposite genders, such as societal morals on modesty and a lack of resources. With the help of 7 doctors, we were able to empower over 70 members of the community, including the Pradhan family, consisting of 3 generations of women, a grandmother Yasmin, mother Nazish, and daughter Ishal. Over the past year, we have focused on hosting in-person tutorials. However, with the current pandemic we are facing, we have modified our plans for the summer and indefinite future. The opportunity to expand our impact using online platforms has never been greater. Over the summer months, we plan to build our own Project Breathe website. This website will explain our mission, contain bystander CPR tutorials, and more. It will be a centralized place to connect with our tutorial participants while building our in-person workshops. The second component of our strategy entails our social media platforms. This will leverage our ability to spread awareness of our initiative to our university peers, better informing them of bystander CPR while recruiting them to join our efforts. Although COVID-19 has altered our strategy and focus for the summer, building our online presence increases awareness that will allow us to unlock our greater potential in the future.
While we are familiar with the words mindfulness, mental wellness, and meditation, how many of us truly understand the depth and complexity of their meaning? There exist countless mental health centers, services across campus, and a plethora of resources online, yet depression among youth has increased up to 60% since 2000. We discovered a dilemma that mental health services face. They fall under one of two obstacles. Number one being accessibility. St. Joseph's Hospital told us that their psychiatric care department had a huge waiting list, with not enough workers to cover patients. Number two was usefulness. We found out from our McMaster's Wellness Center that they struggle with attendance. Hamilton youth needed a program that overcame both of these obstacles. After engaging with our community and performing primary research, we discovered that the Code Red region of Hamilton faced the front end of mental health issues. As mentioned, these pockets of poverty face many social, financial, and economic disparities. And as a result, hospitalization rate for anxiety-related disorders for Hamilton children skyrocketed from 20 to 187 per 100,000 people in the last decade. Seeing as this is a prevalent issue in our region, we are interested in finding out how we can make a difference. In our research, we discovered the transformative benefits of meditation and mindfulness on mental health. According to the American Psychological Association, research on mindfulness has identified the associated benefits such as reduced stress, emotional reactivity, and many more. Based on this information, Project GROW aims to empower youth through mindfulness education, experiences, and actionable steps. A McMaster Wellness Counselor provided us with incredible insight on different activities and resources that we can implement into our program and how to make sure that we are not trying to perform the work of a professional. We have also been in contact with Cindy Garam, a leading figure in the Hamilton Teachers Union who lives in the Code Red region herself. One of our stronger suits compared to mental health institutions is that as youth ourselves, our group would be better able to resonate with the current pressures that youth face without the intimidation factor that comes from approaching a professional. We piloted our first event and geared it towards students at McMaster University. We ran through our program with 16 students, incorporating resources such as meditation and mindfulness eating. We also created a post-event survey and were scored on these metrics: 4.75 on overall experience, 4.4 on usefulness of resources, 4.6 on recommendations, 4.5 on willingness to return to the event, and 3.8 on likelihood to practice mindfulness after the event. Knowing that this was a one-time event, the last statistic indicates the importance of implementing frequency into our program, since creating a regular practice can boost habit building. We utilized the resources and results of the event to make further plans for the upcoming year and improve our program. As a result of COVID-19, we have adapted our programming and goals for the near future. We plan to focus on developing a distinguished program design with an active social media presence through hosting live sessions, interviewing professionals. We aim to grow our online community within this interactive space to encourage others to practice mindfulness, which is especially important during these times. This plan will assist Project GROW to connect and partner with schools in the Hamilton community by September 2020. Our primary goal is to ensure that our mindfulness resources can be used outside of our program while remaining free. When partnering with schools, we have built a sustainable model that prioritizes self-care as top of mind for the students in our program. Assuming school will be open in the fall, we'll be running meditation programming at the beginning of September, then we will follow up at the beginning of October, then every 3 months following that. This frequency will help us create a more familiar and comfortable atmosphere for students. Not only that, they can also continue practicing mindfulness at home using the vast number of free resources we'll provide them. We are excited to continue to support and encourage mindfulness practices for youth and see the transformative benefits come to life in the process.
Together, Project Breathe and Project Grow have impacted communities near and far. With a team of 25 members, we have created meaningful relationships with local community partners, have been working alongside a team of passionate doctors and mental health professionals.
Secured over $4,500 in funding, directly improved the lives of 150 people, and promoted 2 of the United Nations Sustainable Development Goals, good health and well-being, and reduced inequalities. By empowering local and global communities through giving them access to resources and skills they would not otherwise receive, for at Enactus McMaster, we want to be a part of empowering individuals and taking charge in their mental well-being.
And remember, this is just the beginning.